I'm Dr. Kyle Hubler. I'm an orthopedic surgeon at UPMC. UPMC Williamsport has an advanced certification in hip and knee replacement from the Joint Commission. And what that means is that there's a standardized care delivery based on things that work. Your care is based on evidence-based medicine, evidence-based guidelines, and clinical practice guidelines, so that during your continuum of care, before surgery, during your hospital stay, and post-op, these decisions are made so that you have a good outcome and it lowers your risk of complications. I think when the pain in your joint, in your hip or your knee starts to really interfere with your day-to-day activities, your quality of life, and you can't do those things that you enjoy doing anymore. That might mean walking your dog, simply walking to the mailbox. When it's the last thing that you think about when you go to bed and the first thing that you think about when you get up in the morning, it's usually time to have it checked out. Following a hip or a knee replacement, most of the time you're able to be discharged to home, which is our goal on post-op day number 1. We have regular follow-up intervals, usually at 2 weeks, 6 weeks, sometimes 3 months and 6 months. And we like to check in with you, see how you're doing, what kind of progress you're making with your mobility and with physical therapy. Most of the time, by 6 to 12 weeks, you're usually feeling pretty good. You will continue to make gains in your range of motion and your strength and your recovery as far out as a year, even from your surgery. UPMC Williamsport definitely has a reputation for providing high quality, excellent orthopedic care. I think you could feel comfortable knowing that your surgeon and your care team have special training in their field, so that you have the best possible outcome.